Hey everybody, welcome to Journey to Vitality. In this video, we will break down what's going on and why it feels like everything's pushing us to the edge. Did you know that globally, 1 in 4 people will be affected by mental or neurological disorders at some point in their lives? Yet nearly 2/3 of those with a known mental disorder never seek help from a health professional. Stigma, discrimination, and neglect prevent care and treatment from reaching people with mental disorders. Here's why we're facing a mental health crisis and what we can do about it. Global mental health crisis escalates. The escalation of the global mental health crisis is a pressing concern that a multitude of factors have exacerbated. The World Health Organization, WHO, reports that nearly 1 billion people worldwide suffer from mental disorders, with anxiety and depression being the most common. The COVID-19 pandemic has significantly worsened the situation, causing a 25% increase in the prevalence of these conditions. This alarming trend is further intensified by social and economic inequalities, protracted conflicts, and public health emergencies, all of which compound the stress experienced by individuals and communities. The WHO emphasizes the urgent need for countries to transform their mental health policies and services to address this growing crisis. Mental health has become a global priority, requiring immediate and sustained action to ensure the well-being of populations around the world. Youth mental health decline, a growing concern. The decline in youth mental health has become a significant concern, with indicators pointing to a deepening public health crisis. Research shows that feelings of sadness, hopelessness, and suicidal thoughts among young people have increased by about 40% in the decade leading up to the pandemic. The situation has been further aggravated by the COVID-19 pandemic, which has led to social isolation, academic disruptions, and the loss of caregivers for many children and teens. The pressures of social media, mass violence, and political polarization compound these challenges. Psychologists are actively working to understand the biological, social, and structural contributors to this crisis and are developing solutions to support vulnerable children and teens. Pandemic aftermath, mental health toll rises. The aftermath of the COVID-19 pandemic has seen a significant rise in mental health issues, with a staggering 25% increase in the global prevalence of anxiety and depression. This surge is attributed to the multifaceted stressors imposed by the pandemic, including social isolation, economic uncertainty, and the fear of illness and death. Health workers, in particular, have faced immense pressure, leading to burnout and increased suicidal ideation. The pandemic has also disproportionately affected young people, exacerbating risks of suicidal and self-harming behaviors. The WHO has emphasized this as a wake-up call for countries to enhance their mental health services and support systems. WHO calls for urgent mental health care reform. The World Health Organization, WHO, has issued a clarion call for urgent reform in mental health care, highlighting the dire need for a transformation in attitudes and actions. It approaches to mental health and its care. The WHO's comprehensive report, released on June 17, 2022, serves as a blueprint for governments, academics, health professionals, and civil society, urging them to commit to mental health. It emphasizes the importance of reshaping environments that influence mental health and strengthening systems that provide care. With nearly 1 billion people, including 14% of the world's adolescents, living with a mental disorder and suicide accounting for more than 1 in 100 deaths, the WHO's report underscores the critical nature of the crisis and the need for immediate, concerted action across all sectors of society. Suicide rates spike, signaling deepening crisis. In the face of a mental health crisis, hope emerges on the horizon with innovative approaches to treatment and support. The World Economic Forum, in collaboration with Scientific American, has identified the top 10 innovations tackling mental ill health, offering a glimpse into a future where mental well-being is more accessible and practical. These innovations range from novel drug therapies for treatment-resistant depression to telehealth services that extend care to remote areas. Social media data is also being used to spot trends and prevent self-harm, showcasing the potential of technology in transforming mental health care. This wave of innovation provides a beacon of hope for those affected by mental health issues, signaling a shift towards a world where mental health is prioritized and stigma is dismantled. Mental health stigma, a barrier to care. Mental health stigma is a pervasive barrier that significantly hinders individuals' access to care and support. It manifests in various forms, from personal prejudices to systemic discrimination, affecting people's willingness to seek help and adhere to treatment. The stigma associated with mental illness can lead to social isolation, employment difficulties, and reduced quality of life. It often stems from misconceptions and fear fueled by stereotypes and negative portrayals in media. To combat this, education and awareness campaigns are crucial in changing public perceptions and promoting a more compassionate and informed understanding of mental health issues. Furthermore, the impact of stigma extends beyond the individual to affect the allocation of resources for mental health services. Structural stigma can result in inadequate funding for mental health research and disparities in insurance coverage for mental health care compared to physical health care. This systemic bias reinforces the cycle of stigma and neglect, making it harder for those suffering to receive the care they need. Breaking down these barriers requires concerted efforts from all sectors of society, including policymakers, healthcare providers, and community leaders, to ensure mental health is treated with the same urgency and importance as physical health. Economic strain intensifies mental health issues. Economic strain has a profound impact on mental health, creating a ripple effect that extends beyond individual stress to societal concerns. Financial hardships, such as job insecurity, debt, and the inability to meet financial obligations, often lead to increased anxiety and depression. These stressors can exacerbate existing mental health conditions or contribute to the development of new ones. The systematic review published in Epidemiology and Psychiatric Sciences suggests that economic crises are associated with increased use of mental health services, higher prescription drug use, and more hospital admissions for mental disorders. This highlights the critical need for robust mental health support systems, especially during times of economic downturn, to mitigate the adverse effects on the population's mental health. Inequality fuels mental health disparities. The rising suicide rates among youth are a distressing indicator of the mental health challenges facing this vulnerable demographic. Recent studies have shown that more than 20% of teenagers have seriously contemplated suicide, with the rates being even higher among LGBTQ+ teens. The increase is particularly pronounced among Black youth, where the suicide rate climbed by over 36% between 2018 and 2021. These statistics underscore the urgent need for comprehensive suicide prevention strategies that are culturally sensitive and accessible. Efforts are being made to address this through school-based programs, telehealth services, and community initiatives that aim to streamline help-seeking processes and empower youth to support each other. Climate anxiety, a new mental health challenge. Climate anxiety, also known as eco-anxiety, is emerging as a significant mental health challenge in the face of global climate change. This chronic fear of environmental doom is a psychological response to the direct effects of climate events and a reaction to the awareness of the looming threat posed by climate change. Researchers are increasingly focusing on how climate change exacerbates existing mental health issues and contributes to new ones, particularly among vulnerable populations and young people who may bear the mental health burden of climate change more heavily. The need for studies on the prevention and management of climate-related mental health problems is urgent, as is the call for action and activism to mitigate these effects. Mental health innovations, hope on the horizon. In the mental health landscape, innovation is a beacon of hope, promising a horizon where care is more accessible and practical. The World Economic Forum, in collaboration with Scientific American, has spotlighted the top 10 innovations that are reshaping the approach to mental ill health. These breakthroughs include novel drug therapies for treatment-resistant depression and telehealth services that bring support to the most remote areas. Additionally, leveraging social media data to identify and prevent self-harm represents a significant stride in utilizing technology for mental health care. This wave of innovation is a testament to the progress being made in addressing the mental health crisis, offering optimism for a future where mental well-being is within reach for all. In conclusion, the mental health crisis is a complex issue with many contributing factors. By addressing social media use, economic anxieties, and increasing access to care, we can improve mental health outcomes. Together, we can create a society prioritizing mental well-being and empowering individuals to seek help. If you found this helpful, let me know in the comments below. If you want to learn more about mental health and how to cope, be sure to subscribe to more videos like this. Until next time, stay happy and healthy.